Good morning, everyone. I am Jessie Whittish with Kentucky Youth Advocates. Great to see all of you. We're really excited to have today's conversation about vaccinations, both the routine ones and the COVID vaccination as well. So just a reminder that we are recording today's forum as both a video and a podcast. So we ask that everybody stay muted, but we do encourage you to drop questions and comments into the chat. I know when folks RSVP'd, a lot of you had really specific questions, and those we weren't able to incorporate all those into the questions for the panelists. So please do drop those in the chat and we'll try and answer them as we go, or afterwards we'll follow up with you. So with that, I am going to turn it over to Terry Brooks.
Hey, Jessie, thank you so much. I think this is our 105th Aetna Better Health Partner Forums. So we always thank Aetna for letting this happen, but more importantly, or maybe not more importantly, since we have an Aetna representative on the panel, just as importantly, we want to thank you for joining us. I always say, whether you've been here for all 105 or this is your first. So thanks so much. I don't know if my colleague and health guru, Nahek Kalra, will remember this, but literally the month before the pandemic hit, I had shared with she and our partner, Ben Chandler, who runs the Foundation for Healthy Kentucky, a huge spread in Time magazine. And that article talked about herd immunity and the impact of vaccinations or lack thereof on the safety of kids in American schools. What I remember, because we have a former colleague who is a St. Louis-based person, the article featured a case of study of Missouri and what happened in that state, both urban and rural, where schools were being shut down because of measles and chickenpox, not because of COVID. And at the time, Mahek and I had talked to Ben about a collaborative that we were thinking about with the foundation as to could we boost awareness of vaccines. So isn't that interesting that we've got to remember that those folks who think the vaccine debate is new because of the pandemic, it's not. I mean, is it exacerbated? Is it polarized? Is it more headline grabbing today than it was seemingly so long ago with that Time magazine expose? Yeah, absolutely. What we want to do today is talk about that with some folks for whom we have a great deal of respect. And my sense is that there's going to be general conversations around vaccines. And then, yes, we are going to get into the gnarly world of COVID vaccinations. So I just thought it was really important that we frame that issue, that it is not an issue that is totally tied to the pandemic. It was a bubbling issue, a simmering issue, beginning to emerge even before the pandemic. So if there's hope at all, it's maybe that new spotlight on the issue gives folks such as those experts who are joining us today a little bit more visible forum to talk about the issue and to talk about the impact on kids. The idea being that, as you know, we at KYA have a simple but we hope profound vision that we want Kentucky to be the best place in America to be young. Can't even begin that conversation, can you, without talking about kids' health? And that's what we're going to do today. So I'm going to kick it to, again, KYA's health guru. So Mahek, thanks for coordinating and facilitating today's discussion.
Thank you, Terry. And I do remember that conversation. It's like you were already futuristic and knew something was bubbling up. So it's great to have this conversation now. Today we have a rock star panel today joining us. So we have Allison Adams, who is the Vice President for policy at the Foundation for Healthy Kentucky. We have Dr. Michael Kuduk, who is the Vice President of Kentucky Medical Association and a pediatrician as well with UK Healthcare. And then we also have Kelly Pullen. She's the Executive Director of Aetna Better Health of Kentucky, supporting Kentucky's Youth's, which is SKY program. So with that being said, let's kind of dive into questions. You know, this last year or so, we've seen a national and statewide trend around policy change around routine and COVID vaccines. So Allison, do you mind kind of kicking us off and grounding us all on what Kentucky's policy landscape is as it relates to routine and COVID vaccines?
Sure, thank you. So you may or may not know that the Cabinet for Health and Family Services is required under the Kentucky Revised Statute 214020 to promulgate administrative regulations to establish immunization schedules. And for the most part, that they follow the Centers for Disease Control schedule, but also there are recommendations for other vaccines. So you're going to learn a little bit more about that. But the point of bringing awareness to KRS 214 is that it's been in existence for quite some time. Many of us have been required to have our childhood immunizations to enter school. And that's specifically what the statute requires. And it's a certain amount of vaccines, of vaccine preventable diseases to for children to get into school. It's kind of like their certificate to be able to be enrolled in either childcare or public or private schools. So I think there's most important, the KRSs that we should call our attention to are 214020, which gives the cabinet the authority to promulgate regs, and then 214030 specifically addresses the requirement for reception and retention of a current immunization schedule. So if we just take a high-level look at this particular statute, it really lays the burden on the parent or the custodian official of the child under the age of 18. However, the accountability lies within where the child enrolls in school. Whether they are coming for the first time into public or private preschool, first time into daycare centers, or if they're moving from out of state and their first time being enrolled in school. So the school has the onus of collecting those immunization certificates and making sure that the child is up to date on their immunization. And that is actually audited by the Cabinet for Health and Family Services within the Department for Public Health Immunization Branch. And so, if we know how statutes work, we've got kind of the high level, and then kind of the devils in the details are in the administrative regulation, which you will find the immunization schedules for children attending daycares and schools in 902 KAR 2060. So that's where you'll find the list. But I want to talk a little bit about, before I turn this over, I think it's important when we're talking about the current situation we are in. There's also KRS 214036. And this particular statute outlines the cabinet's responsibilities for promulgating laws and regulations for immunizations in the midst of a outbreak, whether it's at a local area, whether it's state, or whether we find ourselves in a global pandemic. And so this law allows for the requirement of a vaccine if there is an outbreak of a disease that's vaccine preventable, but may or may not appear on the normal vaccine schedule. So it kind of just gives that broader authority in order to mitigate the spread of communicable diseases that we are finding ourselves in right now in the midst of COVID. So and each of these statutes have exceptions for, and most of them rely on religious exceptions. But as you all may know, in 2021, Senate Bill 8 made some amendments to 214.036, which expanded the exceptions for the statute as it relates to addressing an outbreak, an epidemic, or a pandemic. And the language was added to, if there's a health reason, religious beliefs, and then Senate Bill 8 allowed to expand an exception for conscientious held beliefs. So these are, I think, and for us as advocates, the most important take-home message in the middle of making sure, as Terry said, we are losing herd immunity way before COVID hit, and now we're in the middle of trying to get many people vaccinated against COVID, is it's calling on us as advocates to continue to educate and continue to push the facts about vaccines, because we do have these exceptions within the statute, but nothing holds us back from people having the right information in order to choose to roll up their sleeves for not only themselves, but for their children that are in their care.
Thank you for that, Allison. That was a great overview. And just from our 2019 Kids Count data book, during the school year 2018-2019, only 88% of students have standard immunization certificate on file, and only 70% of kindergartens during that school year received a mandatory wellness screening. So I just wanted to provide some data behind what Allison was saying. So with that being said, as child advocates, we want to do everything in our power to assure Kentucky's children are healthy and are protected against preventable and potential deadly diseases. And a simple and important step is getting children vaccinated, as mentioned before. So Dr. Kuduk, can you please share why children should receive routine vaccinations?
Absolutely. And before I get started, I'd like to thank your organization for putting out the Kids Count data book. That's something that we use here at UK at various levels of the hospital and the enterprise for data and planning purposes for quality improvement. So I'd like to thank you on that. I'm also a former school board member, and we used to use the Kids Count data book there also. That was reviewed annually at our meetings. So let's see, I think there's been a lot of diseases that have been either eliminated or reduced completely or mitigated significantly by childhood vaccination. And when I do teaching about vaccinations, I always go back to 1952 America. And I ask my students and my learners, what was two things America was afraid of in 1952? So tell me what they are. One was Russia, the other one was polio. And I think we forget about this, and that COVID has kind of brought that to the forefront because we fear that probably as much as we fear polio, but nobody sees polio anymore. It's been, with a couple of exceptions, it's been eradicated in our hemisphere for some time. And it's on the list of diseases we just don't see anymore because of routine vaccinations. So smallpox, chickenpox, measles, bacterial meningitis was once an absolute scourge on children. Rotavirus, many kids in the hospital for diarrhea and dehydration. And these diseases have either been minimized or eliminated completely through the routine use of childhood vaccinations. So we give vaccines to prevent disease and to make sure kids are healthy as they grow up. So one thing about the vaccine schedule and how kids get them, people who are against vaccines will say you're giving kids too many things too frequently. And I would say that the vaccines that we choose to give to infants protect against life-threatening disease. So bacterial meningitis, whooping cough, diphtheria, tetanus are all life-threatening diseases for children. And the reason we have to give vaccine doses frequently over the first year of life, and for those of you who have small kids, you know you're in the pediatrician's office a lot getting shots, 2 months, 4 months, 6 months, plus minus 9 months in a year. And the reason you have to do that is because in infancy, babies don't have immunologic memory. They can't, their immune system can't generate an antibody response that's long lasting. We're seeing this now with COVID that, older people have a problem with immunologic memory too, because they're probably gonna need a booster shot because even though they're fully immunized, their immunity against the new variants are going to wane over time. And babies on the other end of the scale pretty much have the same problem. You can space the shots out once they get a little bit older because they gain immunologic memory and can sustain an antibody response for a much longer period of time. So, but that's why we give children routine vaccinations.
Thank you. That's a helpful overview. And do you mind sharing how many vaccines do Kentucky kids need if you don't mind rattling. I know you
No,
rattled.
that's fine. I didn't tally it up, but I kind of mentally, if I'm teaching this to new learners, I break it into 3 sets. The first set is the set we give in infancy. So these are diseases that we have said, listen, it's worthwhile getting repeated vaccines, birth, 2 months, 4 months, 6 months, 9 months. And often these will have a booster between age 1 and age 2, but we think these are important enough to immunize children early to give them immunity against these life-threatening diseases. So the first one's DTP. Diphtheria can kill you one of 2 ways. It can either form a membrane across your throat and choke you to death, or it can make a toxin which is affect your heart negatively. So nobody knows that because nobody's seen diphtheria in a long period of time. So tetanus still exists. Tetanus is a soil-borne disease. A couple of months ago, we had a kid in the hospital who had neonatal tetanus, who was quite ill. She'll eventually be okay, but she was quite ill at the time. So, and that disease used to be a lot more widespread before vaccination. Pertussis is whooping cough, which we see some of from time to time. The issue there is the original whole cell pertussis vaccine was very effective in producing pertussis, but it had lots of side effects, which created some problems with the vaccine program. The vaccine's been purified, so those side effects have gone away, but the newer vaccine is not as effective. So I think some more research and some more tweaking needs to be done there to make that a better vaccine. Polio was something we immunize small children against, as I previously mentioned. There's 2 vaccines called Hib and Prevnar, which are primarily aimed at bacterial meningitis. So 2 of the 3 major causes of bacterial meningitis are contained in those vaccines. Prevnar is against a bacteria called pneumococcus. The Prevnar vaccine contains 13 strains of pneumococcus. There's 50-some strains out there, but the 13 strains that are selected are the ones responsible for meningitis and really severe disease. So we immunize babies against hepatitis B at birth because of maternal transmission and because that vaccine is particularly safe. So that's the set for infants. There's another set for kiddos between age 1 and age 2. That's where MMR and the chickenpox vaccine comes in. And we also vaccinate against hepatitis A. And then there's the adolescent set of immunizations. That's HPV or human papillomavirus, which prevents cervical cancer. We give Tdap boosters at that age, and that's when we start to give the meningococcal vaccine. And meningococcus is the 3rd major cause of bacterial meningitis. So if you add all that up, it's quite a few. The vaccine schedule can be hard to follow. Probably something that's left up to your pediatrician, your healthcare provider, because the recommendations change slightly from year to year. But that's pretty much up to the administrative regulations that Allison talked about a little bit earlier in our session. And that's kind of the basic landscape. Those are the basic vaccines that we use.
Thank you for that. And I know that there's questions that might arise from parents, guardians, or caretakers around why kids should get vaccinated. And this is really an open question for all of you. What tactics have you used to ease concerns or hesitations around vaccinations?
I can start. I was in private practice for 25 years before I came to UK and was a hospitalist, so I was pretty well versed in this. And I ran into a lot of vaccine hesitancy during my time in practice. Still see it now. And the thing I usually really refer to at that is just my experience during residency. So I'm an old guy. I got my hair cut, so all the gray came off of my hair a couple of days ago, so I look younger than I really am. But I did residency between 1989 and 1992, so I've been at this for a while. And in 1989, that was my intern year, and my supervising physicians drummed into me really hard all about bacterial meningitis. This is how you diagnose it. This is what it looks like. These are the signs and symptoms. This is what it sounds like over the phone at 3 in the morning. These are the kids you need to bring in. This is who needs a spinal tap. This is how you treat it. And when I was in the hospital, I saw lots and lots of it. So at Texas Children's, where I trained, at any given point in time, there were 2 kids in the pediatric ICU being treated acutely for bacterial meningitis, and up to a dozen, 10 to 20 kids up on the floor, finishing off 10 days of antibiotics. We used to see lots of acquired hearing loss, seizures, and a lot of other problems from meningitis. So this is in 1989, which is my intern year. So the vaccine at that time was out and was being given to older children, and it was licensed for infants between 1990 and 1991. So by 1992, I started to see less meningitis. And by 93, 94, when I was out in practice, I saw none, 0, nothing. So this is something I devoted a significant amount of time in training to. The disease which utterly vanished because of vaccination. So it's a vaccine that's exceptionally well tolerated, safe, and extremely effective at what it does. And HIB is the poster child for an effective vaccine. Some of the other vaccines probably are not as good in terms of side effect profile or efficacy, but they all work. So, and I usually would tell that story and I would say, listen, this is the power of vaccines. The same thing happened with polio in the 1950s. This happened with rotavirus. The rotavirus vaccine was out. It had problems. It was taken off. Rotavirus came back immediately and then disappeared again once the vaccine was given. These are bad diseases you just do not want your kids to get. So.
I'll share, Mehek, at Aetna Better Health of Kentucky. I really think, just piggybacking off of Dr. Kuduk, it's really about getting the message out, getting information out, trying to combat the misinformation that our members have about the vaccine. So some tactics that we have deployed are promoting vaccine drives in local communities. We're also leveraging a vendor that provides text messaging campaigns so that we can text out information about the vaccine, why it's important to get it, and combat some of that misinformation. And we're also leveraging our care management department to outreach members to provide that education and also help to coordinate members receiving the vaccine. And we also have been trying to leverage an incentive that we have at Aetna Better Health of Kentucky. We are providing gift cards to members. It's $100 for ages 16 and up, and $25 for members 12 to 15. So in addition to combating, again, the misinformation, we're trying to incentivize our members to get out there and get the vaccine. I do think it's been helpful that the Pfizer vaccine got FDA approval this week. We're really hoping that we see some movement in the metrics for our members in obtaining that.
So I'm a policy person, and so I think that what Dr. Kuduk and Kelly have said, are absolutely the two legs of a three-leg stool in respect to assuring and getting as many children vaccinated as possible. So when I think about just vaccines in general, when you look over time, when vaccines were recommended, we had a certain amount of kids vaccinated, but then when it became required or mandated, it exponentially jumped. So we know that policy works. We know that requiring vaccines work. We understand, though, that we've got to do our most remarkable job at educating and giving parents the comfort level that they need to understand why this policy or why this law exists in order to protect the health and safety of all of us. Now, I know in the current situation, we are struggling with that, and we have a lot of misinformation to combat, not only with COVID, but other vaccines that have been, proven safe, efficacy for a long period of time, but we've had some studies that have been, proven as false. And we know that, we've got to, when something good happens, not very many people hear it. But when something bad happens, everybody knows about it. And so I just challenge us as advocates to make sure that we understand the value of policy and also the value of truth. And, we know that misinformation is out there about the COVID vaccine and other childhood vaccines and even other adult vaccines. And we just got to keep pushing with truth and calling out the misinformation, calling out the studies that don't have, that haven't gone through the research or the peer reviews. And, they're just out there posted. We've got to do our job as advocates to combat that.
Kelly, do you mind talking about the barriers you've seen with the Sky population in terms of vaccines? I mean, we know that this is such a vulnerable population that you all are serving.
Absolutely. I'm going to reframe it, though, from a barrier to really an opportunity for our child welfare system and, partners that are working in concert with us. We know consent has been a topic of concern for this population. In case folks don't know, the cabinet is able to consent to that medical authorization of a child or youth that's committed to the cabinet if termination of parental rights has occurred. If that hasn't, the cabinet really needs to exhaust all options with the child's biological caregiver prior to consenting to the child being able to receive the vaccine. So that's where we've seen the most challenges with getting members vaccinated. But again, I will say, I think this is really an opportunity. We know that in this system, we're trying to transform the system to be one that is more youth friendly, family friendly, promoting youth voice, youth choice, family voice, and choice as well. And I think this has really given us the opportunity to explore how we're having these open conversations with families around the vaccine, how we're allowing the families and the children to really express their concerns about consent, about the vaccine, and how we can do better to bring everyone to the table to facilitate those conversations, help educate them so they can make the most informed choice about the vaccine. And if necessary, right, explore other options. If, a biological parent and, a DCBS worker don't necessarily agree on the path forward for vaccination, how do we address that as a team? So I really think, again, this brings an opportunity for us as a system to implore those models of family voice and choice to help us be able to advocate again to help reduce the effect from that misinformation and really focus on a collaborative decision-making model around, education and consent for vaccines. I will say DCBS has created their own consent form that's really streamlined for kids to be able to get vaccinated. Those are being shared with private providers and of course DCBS parents throughout the state, and Aetna Better Health of Kentucky also has access to that. And in addition to that, we always tell folks at Aetna, if there's difficulty reaching out to a worker to get consent, or there may be different opinions between DCBS and the biological family, to leverage us, use our care managers to help schedule those family meetings so we can have conversation, use our care managers to help get in touch with DCBS. We've seen a lot of success with that. We held a vaccination event up in Northern Kentucky, and Aetna worked very closely with DCBS to ensure that we had private contact information for the workers that were on call after hours, so that if anyone showed up and wanted to get vaccinated, we had a direct line to somebody at DCBS to be able to consent to that. And so I think just really collaborating again, leveraging this opportunity that we have to provide education and information is really going to help drive those numbers for kids in care.
Dr. Kuduk, what barriers do you see as a pediatrician? I mean, I know Kelly just alluded to some, but I was just wondering if you had similar barriers that you want to touch on and opportunities as well.
Yeah, I think the whole thing about COVID, the issue of where people get their information and misinformation has really exploded and detonated. I think it was always out there, but because the states had fairly tight regulations on your exemptions for immunization. I mean, for routine vaccinations, the state allows only religious exemptions. That was a pretty significant incentive to get vaccinated. But one thing I've noticed is that if you just put vaccines or some generic search terms into search engines, you're going to get the anti-vaccination side of the story first. And a lot of people are getting their information through Google and through Facebook and some of these other things. Same reason the Facebook algorithms are going to just continue to feed you information that you're interested in. And really, you're not going to see the other side of the story. So we're not really getting any kind of balanced viewpoint here. I think those of us who are in favor of vaccination really need to try to get the message out. We've certainly seen that with COVID. If you Google COVID vaccine, you'll see both sides of the story. But I think for routine vaccination, getting that positive message out is important. So that's one of the other things. I mean, the vaccination program is kind of a victim of its own success because some of these vaccines are so effective. The only thing people see are side effects, right? So, okay, you get a fever after DTP, right? You're not seeing the pertussis anymore. You're seeing the fever and the side effects, and people react to that, right? So COVID is different. People see COVID, it's out there, it's tangible. Most people know somebody that's had it. that's a little bit different. But, you're talking something about chickenpox where you're not actually seeing the disease anymore. It can be difficult because the side effects become more prevalent than the vaccines. It becomes a much harder sell. So I think that's something else that we need to kind of keep in mind, that some of these vaccines and these vaccination programs have been so successful that the side effects are more numerous than the disease. So, we hear all this stuff about measles. How many of us have actually seen somebody with measles? I have, because I'm old, right? But most of us haven't. So, and if you've seen one case of measles, you'll know it is worthwhile immunizing against. You need one case to convince you of that. So.
And Dr. Kuduk, can you talk a little bit about the COVID vaccine and kind of share, knowing that this is a platform to share educational information, I think having your perspective would be helpful in talking more about it.
Sure. So a couple of things about the COVID vaccine. I think COVID's probably been the biggest public health problem that's happened in my lifetime, and that probably any of us on this call will ever see. I think we've known something like this would be coming, but we thought it was going to be influenza, and it turns out that it was coronavirus, which is very different. So, and actually, I just kind of made some notes before. There are some really common arguments against the COVID vaccine, and I want to take each of those as they come one by one. So, the first thing is that the vaccine was developed too quickly, and it was developed quickly because there was a public health emergency. And I don't think there was any safety shortcuts taken in developing the vaccine. So the mRNA technologies were out there. They're actually being used to create vaccines against cancer cells. So let's say if you have early cancer in your body, these vaccines are designed to go and find and hunt out and kill the cancer cells that were in your body. So that's what they're being engineered for. So that mRNA platform was out there and existed. Once the genetic code for COVID was published, they were able to go ahead and get that into the vaccine and get that out. So the reason it was developed quickly is because the timeline for vaccine development was shortened drastically by the effects of the federal government. So they did a couple things. The first thing they did was they said, listen, ordinarily for a vaccine manufacturer to develop a vaccine and get it out, there are different steps. You have early scientific trials, you have some benchtop trials you go through. Then you have phase 1, phase 2, and phase 3 trials, which enroll successively larger and larger number of people. And at each step, you take a look at the vaccine, not only to say, is it effective, does it work, but the vaccine manufacturer says, can I make money off of it? So, and there are a lot of promising vaccines that there's not a market for, so they never see the light of day. So this all changed because the federal government said, listen, we need this vaccine, we need it yesterday. We're going to remove all those barriers, and we're going to allow you to overlap these phases. So that's the first thing that happened. Second thing that happened is the federal government says, listen, if you make a vaccine, we don't care if it works or not. We're buying 5 million doses or whatever the number was. And the number they cited was high enough to cover their costs of development. So the financial risk was removed completely from the vaccine manufacturers. So they're all in on that because they knew if they developed a vaccine that worked and technology that worked, there'll be a market for this vaccine afterwards. But for the federal government is able to release and speed up the process immensely by offering big economic incentives. So, and it's something that we do in other forms of government. We offer tax breaks if we want to shape behavior in a certain way. The government's basically doing the same thing. So, second thing people will say, it's not been tested enough. There have been 5 billion, billion doses of vaccine given worldwide and 365 million doses given here. After I got my COVID vaccination in late December, I got text messages from the CDC asking me if I had side effects, asking me if I got sick. There's a significant amount of post-vaccine surveillance out there. So the phase 4 study is 360 million and counting. So it's out there, it's safe, it's in common use, and it has some problems. There are some side effects with it, but it's certainly better than getting the vaccine. And I think the other thing is I'll kind of address the issue with children and pregnant women. And I think this is a side effect of the scientific review process that we use. Anybody who has worked on an IRB or an institutional review board, which is something that if you're going to do a scientific study, you have to get approval from your institution and certain rules are followed. So back in the 50s and 60s, going back to polio vaccine was given to institutionalized children. And there are some very unsavory things done with the vaccine then, which we would kind of react in horror about now, but which were kind of standard of care back then. Nobody seemed to think that was an issue back in the 50s and 60s. So because of that, there are many rules and regulations which are added to vaccines. So to streamline the approval process and to get the vaccine out as quickly as possible, children under 18 and pregnant women were excluded from the initial studies. So, and because of that, when the vaccine was approved, it was not approved for those two age groups. And the reason is those are protected groups. You have to take extra effort and care when you're doing any type of research involving those two groups. So this is translated to the vaccine is not safe for these two groups, which is not true. It's just that there's a delay in obtaining the data. So I think that's an issue. We're seeing that right now at UK. We have a significant number of moms that are COVID positive and are having all sorts of prenatal complications due to that state. Because COVID is not good. Low oxygen levels are not good for fetuses, and decreased placental blood flow is not good for fetuses either. And if you got acute COVID, you have both of those. So the other big issue, I think, with looking at COVID vaccination from children is that children have less severe disease. That with Delta variant, it's not true that they have no disease, because if you look at the numbers coming out of UK, this week we added children to our report, and children make up about 10% of UK's COVID numbers right now. We're seeing a significant number in the ICU and on the floors. So with the Delta variant, which is much more infectious, we are seeing disease in children. But again, side effects are an issue there, because you have a side effect that's relatively common, and you're giving the vaccine to a 60 or a 70-year-old who you know is going to have severe disease, you'll accept that risk. But if you have that same common side effect and you're giving it to a 12-year-old whose risk of serious disease is much lower, that's a different calculation. So, and those are some of the things that are going on right now. So.
Mahek, I'm going to drop in the chat if you don't mind. The foundation has put together a resource for anyone who would like to use it about the COVID-19 vaccine myths. So it's kind of like those myths out there, and then your answer to combat the misinformation. So I'll drop that in the chat. Please feel free to go out to our website and use.
Yes, that's great. And Allison, are there any that Dr. Kuduk hasn't mentioned that you want to highlight right now?
I think the one that really comes to my mind, especially from my public health experience, not just with COVID, but it's ran over into COVID, is that the fear of getting the disease itself if you get that vaccine. And I think that that's one of the things that we combat a lot, is people worried about getting the disease as a result of the vaccine. And, I think it's important here where we note that, it does take 2 weeks to build some sort of an immunity up to 2 weeks to build some sort of immunity from the vaccine that you got. So exposure prior to the vaccine or, immediately after doesn't necessarily provide you all, and you can exhibit those symptoms. So we do combat a lot of misinformation about the potential of getting the actual disease from a vaccine. I think that that's probably the most common that we see across all vaccines schedules.
Certainly. So this is kind of again, another open question to all of you all. Are there lessons learned from routine vaccinations, knowing that they've been around for a while, that could help promote the COVID-19 vaccination? Anyone can start it off.
I think we're taking a lot of the lessons we've learned from vaccine development. Think about it, vaccinology, we just started to understand about viruses in the 40s and 50s. So much of what we understand about viruses came from research on polio vaccination. So here we have another huge public health crisis, and we're learning more about vaccines and viruses as we move forward. So I think we've been able to take the technologies that are out there. At one point there were close to 1,000 COVID vaccines in development somewhere. Many of those have fallen off the trail for one reason or another, but there's still a lot of vaccines that are out there in development. We may have things that are come out that are more effective than we have now.
I think that to Dr. Kuduk's point, I think that, we need to make sure that we understand that the technology to develop vaccines has been around. It's the opportunity to isolate the germ, whether it's, bacteria, whether it's viral, whatever the germ is, it's the importance of isolating what that is and then adapting the technology to it. So it's not, yes, the COVID, the coronavirus, it was novel to us, but once it was isolated, the technology to develop the vaccine and go through the steps was not new. And so I think that we did a little bit of a disservice identifying novel, and then all of a sudden we come out with the vaccine that's it really wasn't that rushed. That technology was there. The good news is that we have people way smarter than me that can isolate those novel viruses and novel bacteria, whatever that might show up, and can create and develop that vaccine using the technologies that are already existent in our current vaccines that we have today.
Kelly, do you have anything to add?
No, I think what Allison and Dr. Kuduk had spoken there definitely covered the topic. They are the medical experts, so I defer to them.
Okay. So just thinking through, since it is National Immunization Awareness Month, it's an important time to highlight the importance of vaccinations for all ages. And just a quick question of what have each of you all done to promote increased vaccinations? What does work? What doesn't work?
I think personally, people listen to their physician. There's a lot of stuff that's out there in the media, but this studies have looked at this with ways to increase COVID vaccine uptake. And one of the most important things is just contact with your physician, having your physician recommend the vaccine. That seems to be very important. So personal one-on-one contact. A lot of times people would come into my office and, they have their stuff and they'd done their research and they were against vaccines. They would talk to me and I'd say, listen, this is why you should get it. Would I give it? Did I take it myself? Yes. Would I give it to my own children? Yes. I think that's what they want to hear.
I agree, Dr. Kuduk, and I think to add on to that, we need to make sure that the vaccine is readily available at the point of decision. Once the doctor, convinces if or changes the mind of their parent, that vaccine needs to be ready to administer to that child, not send them somewhere else, or and sometimes that's a barrier in and of itself, where vaccines are expensive for doctors and to keep on site. There's rules and regulations if you are involved in federal or state programs housing vaccines, and so it's another policy ramification or something that we should look at it in making sure that we have vaccines available at point of suspension or point of decision, so that when you had that education and the adult or the parent, whoever, when they nod their head and are ready to consent, that vaccine should be right there with them. So I think that, that's to me, I think we see that we have higher uptake as opposed to convincing someone and then sending them off to somewhere else to go get it.
For us at Aetna, as a managed care organization, we really leverage our resources and our care management and our quality departments around immunizations in totality. Anyone that's in SCI is already enrolled in care management. For our traditional population, people opt in or out of care management. But we have care managers who are outreaching members. We can see from claims from the immunization registry if a member has obtained all of their immunizations or not. And then our team can make those coordinated outreach attempts to help the member go and obtain whatever is needed. We can leverage, transportation benefits, other incentives that we have for people to get vaccinated to help drive up those numbers. And our quality team has, a HEDIS coordinators who really kick it into high gear, to kick off a HEDIS campaign to help provide education, outreach about the importance of getting vaccinated, and again, help coordinate those services for our members. So we're really helping to provide the resource to get the vaccines and also provide that information and then managing that care for our members, which has been very helpful.
So my last question to each of you all really is, where can advocates learn more?
For Aetna, advocates, for anything that we're providing, advocates can go to our website, which is aetnabetterhealth.com/Kentucky. People are also able to outreach any of our outreach team. I'll put some information in the chat for you all for Aetna.
At the third week of September, I'm going to give a shameless plug for the 2021 Howard Bost Policy Forum that the foundation puts on. And this year's forum is completely focused on vaccines. So not only for COVID, but we recognize, like Terry said, he had an early conversation with my boss, Ben Chandler, and some work was already in place of trying to figure out what we could do to improve vaccine uptake in Kentucky months before we heard the first ring out of COVID way back in, it seems like forever, right? Way back in 2019. Anyhow, the annual Bost Forum is free. It's a virtual event. I'll drop the registration in the chat. You do need to register, and it will also be recorded. So but in order to get the links, you will need to register. So if you can't attend the entire thing, it's a 1.5-day event. Please, I encourage you to go ahead and register so you will have access to the materials. The HHS Secretary Javier Becerra will be our keynote speaker, as well as Dr. Stephen Stack, our Commissioner for Public Health, to just give us a rundown of the state of vaccinations in Kentucky. I know we want to hear about COVID, but we also know that we can't ignore some of the other issues, and Kentucky is losing our herd immunity for certain vaccine preventable diseases. So I'll drop that in the chat, and it's a perfect opportunity. It's panel discussions, child vaccines, adult vaccines, policies, immunization registry, all the things that kind of roll up into what can Kentucky address by policy implementation or improvement to improve vaccine uptake in Kentucky. So I'll drop that in the chat.
And for me, vaccine.org has always been a go-to source of information. They have vaccine information statements. If you're a practice, how to navigate the storage and data logging requirements, and lots of information that's out there. So I'll throw one other thing out. This is the Kentucky Advocate Forum, or Kentucky Youth Advocate Forum. And one other place you need to look as a resource is the Legislative Research Commission's website. And you need to check out which bills have been pre-filed for the upcoming session. Allison is nodding her head because she knows that the authors of the original Senate Bill 8 basically brought back what wasn't passed and put that back out. So, and I think the anti-vaccine group and the anti-vaccine lobby is mobilizing right now. I think they see the current times as a way to advance their agenda and to erode our current vaccine program. Their goal is to allow conscientious objections for all vaccines, not just COVID. So I think that's their goal. And if you read the legislation that's been written by some of their sponsors, that's what their aim is. So this is a problem, because if and when this is passed or goes through, and I will be working vigorously to stop it, but we're going to start to see some of the diseases I mentioned come back. So we will see measles come back, certainly, because once your population is no longer actively immunized against measles, that disease will return. So it is, and some of the diseases I mentioned are diseases more contagious than the Delta variant. We talk about the R0-4 diseases. That's if you've got a bunch of unvaccinated people that are exposed to a disease in a room or an area, for one infected person, how many people will they get sick? So the original COVID was between 1 and 2. Influenza is probably between 1 and 2. RSV is between 1 and 2. So all the respiratory viruses are kind of grouped together. The Delta variant is somewhere probably around 4 to 6, but it pales in comparison to varicella, which is around 10, and measles, which is around 12 to 18. So even a small erosion in the number of people that have measles vaccination, measles will come right back. So that's the kind of thing that we're looking for. And I really think that the anti-vaccine lobby is taking this and trying to capitalize on public sentiment and the political capital they have built, both locally and nationwide, and trying to advance their agenda. So I think that's just bad for the population of Kentucky. It's bad for our youth's health, and it's dangerous.
Agree. We must start to recognize those early pre-file bills and advocate precipitously against them.
So for those that are joining us today, it seems like we have our marching orders. One being sharing information that was heard here today. Also advocating and looking at the current policies that are, either pre-filed or filed last year, just to get a sense of what's happening. And then lastly, attend the Bost Forum. It seems like a great way to hear more information around not only COVID vaccines, but routine vaccines, and hearing from a national leader around this particular topic as well. So I just wanted to take a second to say thank you to our panelists. You've provided us with a wealth of information. And also thank you for celebrating National Immunization Awareness Month with us by talking about this topic. And with that being said, I am going to turn it over to my colleague, Carly, to wrap us up.
Thanks, Mehek. So I just want to echo Mehek's sentiments and thank our three panelists for providing us with some really important information on those routine immunizations and a little more specifically the COVID-19 vaccine and how we can advocate for the vaccination of our kiddos. So we also want to thank Aetna Better Health of Kentucky for their support of today's Advocate Virtual Forum. Looking ahead to the upcoming forums, we're in lieu of our typical Wednesday Advocate Virtual Forums, we are actually going to be hosting next week the Kinship Families Coalition of Kentucky's virtual summit on Thursday, September 2nd. And then we will then be taking the following week off due to the Monday holiday. So as always, the follow-up email will include a recording of today's forum, along with some of the resources that our panelists shared with us today. And we'll also have a link to sign up for next week's Kinship Summit. So thanks again for joining us, and we hope you all have a great rest of your day.